To wrap up our live coverage now from Chris Hani Baragwanath Hospital. We've been celebrating the fact that the COVID-19 ward there is empty, and we also spoke to some of the amazing frontline healthcare workers taking care of coronavirus patients. Crossing now to Gareth Edwards at the hospital. Gareth, what do you have?
I just thought it would be fascinating before we say goodbye from our special coverage here at Chris Hani Baragwanath Academic Hospital. I want to remind you we're not in the main hospital, if you want to call it that. It's a specially designed and newly built structure because of COVID-19. It's called an ABT, if I have my acronyms correct. But let's find out exactly what that means and a bit more about the facility, because we've spoken about how incredible the medical teams are as well that we have here, but they can only work as well as the facilities and the building allows for us. So let's find out about the building a little bit more now from Dr. Vis Naidoo, facilities coordinator here. Doctor, pleasure to have you with us. You were the first person I met here this morning, and you were showing me the photos of when this was nothing but just dust and sand, and it was less than a year, and we've ended up where we are now. One could argue a world-class medical facility. Congratulations. I mean, how happy are you with how this turned out?
Yeah, I'm very proud of the Department of Health and Department of Health to have put up a structure like it. This is one of this world standard type of structures, and what we see hopefully will be the future of health facilities.
What is the future of this? Because right now it's nice and empty, and I want to re-emphasize to those who just joined, having an empty COVID-19 facility is actually a good thing. It's not like an empty stadium. We want no patients here. But what is the future of this beyond COVID-19?
Yeah, as you mentioned, it's ABT. ABT meaning alternate build technology. So we can repurpose this within a short period of time to anything that health facility that we desire. So tomorrow, if we need theatres, we can repurpose this thing within a short space of time, less than 2 months. We can put 400 theatres or 200 theatres, whatever the requirements may be. That's the advantage of this structure that we have. And this is one of the kind in South Africa.
And I think that's why it's so important to know as well that, because people are going to look at this, they're going to watch you and I talking now and go, what's going to happen with all this equipment? It's a waste of money afterwards, but it's going to get reused as well. How well was this handling COVID-19 at its height, maybe during lockdown level 3, the third wave, when this was built? What lessons did you learn during the third wave that you're going to take into the fourth wave?
Yeah, but we can, as one can see from the footage, that this is a state of the art. It's a very therapeutic environment, and I think it made good and for the fourth wave, we know we're prepared. This is a facility with 500 beds, and each bed can be converted to an ICU bed. It has all the necessary health technology. So we are ready for this, and it can also be used as low care. So that's the advantage. And looking at the building itself, the infrastructure, it is well purposed for anything that.
And it's very, very well put together as well. Congratulations to you and your team, and all the very best for the fourth wave. We know it is coming. Hopefully we're not going to have patients filling these ICU beds as well. Dr. Naidoo, what a pleasure. Thank you very much for joining us here on eNCA. Dr. Vis Naidoo, facilities coordinator of the ABT. Now you know what it stands for, Toombs, here at Chris Hani Baragwanath Academic Hospital. And that's where I'm going to end our coverage for today. I just want to say a huge thank you to all of the medical teams who came out to speak to us this morning, all the professors, the doctors, the experts, the Department of Health, and all those unsung heroes that I have seen walking around these wards, saving lives, keeping families together, and taking the fight to COVID-19. It's very impressive when you see them doing it in person. So for the South African Morning from the facility, I'll say goodbye for now.
All right, thank you so much, Gareth. Excellent coverage there for us at the Chris Hani Baragwanath, but also equally seeing those visuals and understanding now that we too have a responsibility to protect our healthcare workers and protect one another by making sure that those beds are kept empty.